Hello and welcome. I'm Jeunesse Castonguay, VP at Clarius. It's wonderful to see so many of you here today. Thanks for joining us. You're among 2,200 clinicians who registered for this popular Intro to Ultrasound webinar called Facial Filler Safety 101, Ultrasound Mapping for Accurate Aesthetic Injections. We're excited to host our first online educational session with the renowned Dani from Sparkle Aesthetics, who'll be joining us shortly to share her patented and trademarked ultrasound technique called safe mapping, which she says is the quickest and easiest application of ultrasound in facial aesthetics. Safe mapping redirects the injector to focus on the task at hand by answering the question, is it safe to inject filler in this exact spot, instead of mapping vascular structures around the face? With the growing popularity of facial fillers in social media, there has also been a growing awareness of risks and complications, from misplaced fillers to more serious intravascular occlusions. You'll gain newfound confidence today in the safety of your treatments as Dani explains 4 simple moves to check a target spot before injecting. First, a quick housekeeping note. Please do feel free to use the questions box at any time during today's webinar, as there'll be a live Q&A session with Dani following the presentation and live scanning. It's now my pleasure to introduce you to Shelley Gunther, your host for today's event. Shelley is an experienced sonographer with over 25 years of experience as a clinical ultrasound expert. As clinical manager at Clarius, Shelley is dedicated to providing the highest quality educational content for clinicians looking to add wireless ultrasound to their practice. She helps us deliver practical webinars like today's event and video tutorials for our Clarius Classroom, which now features over 400 on-demand video tutorials. Hi, Shelley.
Hey, Jeunesse. Thank you, and thanks everyone for joining us for, as Jeunesse mentioned, our first aesthetic webinar with Dani Shearer. Now, over the past year or so, we've been hearing more and more about ultrasound use for guiding fillers, which means that we're all becoming a little more experienced all the time and becoming experts and developing our own techniques to suit our specific needs. Dani's a perfect example of this and has even trademarked her technique, which we'll hear about shortly. But before we get to the presentation, I'd like to present a bit of literature about ultrasound use in facial aesthetics. So this first paper is an update from the Journal of Cosmetic Dermatology, and it mentions that in previous years, ultrasound has not routinely been used in cosmetic dermatology, as we know, because the equipment was large, it was really expensive, it wasn't really readily available, and the imaging just wasn't that great. So the miniaturization that we're seeing now and reduced costs, and especially the higher megahertz frequency, provide improved quality of the superficial tissue layer that we need for aesthetic imaging. Now, the use of ultrasound leads to reduced chances of complications and clinical failures, rendering more safety and high quality. And I quote from the article, as doctors, we owe it to our patients to do our best to prevent any harm. Now, this next paper here is a group from Brazil. They noted that filler procedures varied quite widely among professionals. Safety mechanisms such as aspiration and the use of cannulas don't necessarily ensure total safety against vascular occlusions and events caused by the filler. So they've developed a technique for safe injections using Doppler. So like I mentioned, there are more and more techniques being developed, all in the name of patient safety. And finally, this is a brand new article from the Aesthetic Journal, Surgery Journal, aimed at describing the basic principles for filler with the assistance of high frequency ultrasound, in particular, color Doppler or power Doppler. And the techniques were both scanning before the injections and during the injections. And the authors summarized the steps involved when getting started to use ultrasound to guide aesthetic procedures. It's a really great article that covers everything from equipment choice to practical issues related to the various procedures. So I highly recommend it. So let's throw a poll out there to see get a lay of the land and who we're dealing with here. So what do you see as the key benefits of adding ultrasound to your aesthetic practice? Do you just want an improved understanding of the facial anatomy or improved safety? Or do you just want increased referrals? Give this a couple of seconds just to close out the poll. 3, 2, 1. Great. So I think increased awareness of complications. And so definitely people are wanting to avoid those complications and provide better care for their aesthetic patients. All right, so let's get started. I'm so happy to introduce physician assistant Dani Shearer. Dani's a Florida native, but she moved to Chicago after graduating from Washington University. Though her first career out of college was an improv comedian, and I'm sure you've seen her Instagram, you'll appreciate this. She eventually found her way back to medicine in 2008. She attended Midwestern University's physician assistant program and went directly into emergency medicine. And after practicing as an ER physician assistant for 10 years, where she used ultrasound extensively, Dani became interested in aesthetics. She's one of the few trainers for the ultrasound and aesthetics in the USA and teaches one of the only accredited ultrasound courses for injectors. In 2022, Dani won a National Aesthetic Award for her safety standards and techniques. And as a pioneer in the field of ultrasound and aesthetics, she holds several provisional patents for her many techniques as well as her unique course. So over to you, Dani, to tell us all about your less intimidating ultrasound techniques for avoiding intravascular injections.
Well, thank you so much, Shelley, for the kind intro, and thank you, Clarius and Janez, for this awesome opportunity. It's really an honor for me to be asked to participate in the webinar because, as everyone at Clarius knows, I've been a big enthusiast of ultrasound and a big proponent of the Clarius handheld for the past several years. So it's really cool to be asked to participate. So thank you guys all very much. I'm going to get started talking about safe mapping, which I do believe is kind of like the easiest way to get into ultrasound. I will tell you a little bit about my background. I won't get too much into my comedy career because we all know that a career as an improv comedian is actually just a person without a job for the most part. So now I do have a job as a PA, which is great. But after comedy, I went into PA school. I always had a craving to be in medicine. My father's a physician and my mother's a nurse. So I kind of felt like it was a calling in some ways. And I fell in love with emergency medicine. So for the past 15 years, I have been an ER and trauma PA at a level 1 trauma center in Chicago. And it's been a really incredible time for me there. And I've learned a lot about anatomy. I learned a lot about procedural medicine. And that's where I picked up all this ultrasound stuff. So even before I got into injecting, I was very into ultrasound. So I got into ultrasound guided procedures like ultrasound guided central lines and peripheral lines, art lines, ultrasound guided joint injections and aspirations. And it became like a real passion for me, just doing ultrasound guided procedures in the ER. And at one point I did think, gosh, I wish there was a way I could just do ultrasound guided procedures and nothing else in the ER. So it's been a huge part of my passion for medicine is using ultrasound. So when I became an injector, I always joke that like the injectors who have been in emergency medicine are the most paranoid injectors out there, because people who have worked in the ER have seen the worst of everything. They've really seen anything that you should go right, go wrong. And that comes for, that goes for like going out for a drive in your car or, getting a little quick procedure at the eye doctor, all these things I've seen go wrong. And so when I became an injector, I always joke that I suffer and still do. I'm a recovering nervous injector. So when I became an injector, I was really struggling with kind of the fears of what could go wrong with my injections. And the idea that we were injecting blindly into the face when there could be a complication like irreversible blindness, it really paralyzed me in terms of my ability to feel comfortable and confident with what I was doing. So those of you who don't follow me on Instagram, I'm gonna put you through one of the ridiculous things that I do on there, which is like make comedy videos about the aesthetic industry. And this was one that was inspired by how I was at the beginning of my injection career. So this is where I kind of had Ronna Kennelly play me as a as a new nervous injector.
Oh, I'm so sorry. Did I hurt you?
No, I'm okay. That's what I signed up for.
Oh my gosh. Can you see?
Yeah.
Can you see?
Yes.
Are you having a stroke? Oh my gosh, somebody please get me some Hylenex!
So, it's obviously hyperbole there, but it's how I felt. My husband used to make fun of me when I started out injecting filler, 6 years ago. I would sleep at night with the cell phone next to my bed because I was like, what if I blinded someone today and they call me in the middle of the night and I need to like deal with it? And like, what will I do? Like, how do you reverse blindness? And all these crippling fears were really going through my head. And so I wasn't having a good time as an injector, to say the least. I was just too nervous about it.
It is so true. Hey, like once you kind of know what's in there, you worry more and it just makes you more aware.
Yeah, exactly. I mean, you have cowboys out there that are just like, it's fine. But I was not a cowboy. I don't think many people who come from the ER, they don't have a cowboy mentality because they're just like, oh, geez, I don't want my patient to be going to the ER with blindness and have it be like, who did this to her? And so I thought to myself, okay, if I'm going to inject, and I do a lot of ultrasound guided arterial access with art lines, and I can access any vessel I want pretty much if I can see it on ultrasound. So I thought to myself, well, I could definitely use ultrasound to avoid arteries. If I want to just inject filler, I know I can do that. And at the time, there really wasn't a lot of people using ultrasound in aesthetics at all. In fact, I know Dr. Weiner at the time, he and I were like among the first couple to get the Clarius, and we kind of, I remember like DMing with him back in those days of like, oh yeah, I heard you got this device too. So there really weren't a lot of people back then using it. And so I kind of had to start just brainstorming, okay, well, how can we, I know I can identify vascular structures with the ultrasound, but is that what I want to do? So I was always kind of like tormented with like, what if I caused a vascular occlusion? And the funny thing is that now, as somebody who uses a ton of ultrasound, I manage so many complications and vascular occlusions that it's like the idea that, if you told me 5 or 6 years ago that I'd have as many vascular occlusions in my chair as I do now, I'd be like, I can't do this career. But now it's kind of like, oh, there's a vascular occlusion, and it's because I have ultrasound and a comfort with it that they don't scare me like they used to. I mean, and knowing that I have the ability to prevent them is the most important thing. So that's really where this idea came from, is using ultrasound as a beginning tool to prevent a vascular occlusion, rather than what we hear about a lot, which I don't really like this term, vascular mapping. And the reason why I don't feel like vascular mapping is what we need to be doing, because when you look at like a CT angiogram of the face, or this model of like the vessels of the face, it's like, who wants to map that? That's kind of like a 2-hour process and what do? You take your ultrasound, you're following the course of every vessel, that you see. And I kind of thought to myself, well, I don't think that we need to vascular map to use ultrasound if all we want to do is put a needle bolus in the chin of filler. So I came up with this idea of safe mapping to kind of say, all right, we don't need to vascular map. We can keep it simple. All we need to know is, can we inject some filler into these particular spots? So, and I also thought, like, because I do a lot of education on ultrasound, it really struck me as a lot easier for people to understand as I was teaching, because we would be, looking for vessels in the face as an academic practice, as more of like an activity, to say, okay, where's the infraorbital artery? And then they'd say, okay, well, if that's where the infraorbital artery is, do we need to mark that so that we don't go there? And that really struck me as dangerous, because if you are marking where you think the infraorbital artery is, and then you inject like next door to it, what if you didn't catch a branch, and then you're using ultrasound to kind of vascular mark which I don't think is the right thing. So in terms of using ultrasound, I like to encourage people to think about the idea of safe mapping as your entry level, and kind of in these 3 phases of getting good at everything. The worst thing that I hear is someone saying that they bought an ultrasound because they want to have it in case of vascular occlusion. And to them, I say, good luck with that, because it is really hard to manage a vascular occlusion on ultrasound. And you have to have a keen understanding of what you're looking at. And you have to have very good ergonomics with doing ultrasound guided injections before you're able to manage a vascular occlusion. So
it's kind of like you want to know how to run before you can walk.
Exactly. So safe mapping is really that kind of walking step, where you are just checking the one spot that you want to put filler. And then you get really good at that. You get really good and comfortable and confident with these steps that I'm going to show you. And then after that, then you're going to start practicing ultrasound guided stuff. And that's a whole nother day of practice with me. And then managing complications, that's something else that, that's really pro level, like I can't remember the Atari levels, but there's like a 3rd level that's like really hard in Atari. So that level is you're managing complications. So as far as safe mapping goes, I like to think of the face, without ultrasound, it's really like a dark pool. When we're injecting blindly in the face without ultrasound, it's like swimming in a dark pool at night. And to me, as a Florida native, that used to really freak me out, that there were like snakes in there. Or one time I found a mole, which I didn't know could swim, but I got really freaked out by the creatures in the pool. So safe mapping, it's really like, if you envision that dark pool analogy where you're flipping the light on, and you can kind of see and hear. I like this analogy because with turning the light on, you're able to kind of really visualize all that's in that beam of light, or in terms of ultrasound, it's sound. But you're able to see what's there. And then safe mapping is where you go, okay, I know I'm going to swim right here. And Shelly, can you see me wiggling that little cursor there? Okay.
Yes.
So like you turn your light on, you go, okay, right here is really safe. I'm going to turn my light back off, and I'm going to just swim right here where I just checked. Okay. Now ultrasound guided is where you go, you know what, there's this snake over here in the pool. I got to keep my light on the entire time. And while I swim, I need to keep my eye on this dangerous, snake or artery or whatever's there you're trying to avoid. And that way, at all times where you're swimming. So the pro of safe mapping is that it's a lot easier for beginners, because you don't have to deal with the ergonomics, which can be really cumbersome at first for a lot of first-time ultrasounders. Even with advanced injectors, I have people who come to me that have been injecting for 15 years, and they're just as new with the ultrasound as somebody who's been injecting for 1. So I always tell people it's a lot easier to safe map, even if you are a pro injector. You just get good at that. So the con of safe mapping, the limitation, is that you're not getting that live feedback of what your cannula is swimming around, So the other pro of safe mapping is that you can take the ultrasound off the face and you can clean really well. So the con of ultrasound guided is that you can contaminate your field with the device. So you have to be very careful about sterility of the device. You can put a Tegaderm on your device, or, some crazy people have used condoms, but they work too. So when I kind of try to break it down for people to understand what areas are safe mappable, in my opinion, and which areas should we think about doing the ultrasound guided areas. So safe mapping, you want to think about those areas that you want to lay a needle bolus. Okay. So common needle bolus sites are generally the safe mappable areas. So I like to think about the chin as safe mappable. The cheeks, those needle boluses along the zygoma or in the cheek area, the pregal sulcus. So, right up front. That's a great spot to do a safe map. The gonial angle, you know, where we see a lot of injectors lay needle boluses in the gonial angle. And then when it comes to temples, you know, I put plus minus here because the temple is a pool, you know, so you have kind of like it's like if you picture like the concavity of a pool, you really have to be ready to interpret kind of like a 3D intersection of your crosshairs, which we will get to. So it's also in terms of the level of risk of doing that deep needle bolus, that, you know, one up, one over site, that's the high risk procedure. You know, it can result in blindness. So you want to think about like, how good are you at safe mapping? How comfortable are you? Are you able to interpret that 3D intersection? So that's really one that I advise against for a new safe mapper. Now, better for ultrasound guided procedures, you think about the temples again and the piriform, because these are, you know, the higher the risk, the more difficult it is to think about doing a screen with the ultrasound, you know, because again, the piriform is another pool. So you have to understand exactly where everything is. And the other thing to think about in the piriform is that oftentimes when we look on ultrasound, the angular artery, even though it's not on bone, if you measure it out, you can see a lot of times it looks like it's way off bone, but if you measure it, it's 3 millimeters away, 2 millimeters away. So those are the higher risk areas that I recommend doing ultrasound guided. So what I'm going to do now is I'm going to just show you a few different occlusions that I was involved with trying to help. And so I kind of heard the story of them and I thought to myself, well, these occlusions could have been avoided with this safe map. So the first one I'm going to show you is this transverse artery occlusion. So the story with this one is that she had 4 needle boluses, and then, you know, became really ischemic and kind of white in the cheek, and then I got that call. So how would you have safe mapped that? I want to encourage everyone to think about each needle bolus needs its own safe map. So these are the 4 steps. The first step is you're going to just start with just circling the areas that you want to put the filler in. That is your first step. So we don't need to do this like ultrasound first, check out where the artery is. You don't even need to do that before you start. You're an injector, you're starting with the question, where do I want to put this filler? So each needle bolus that you want to put your filler, you're going to do a little circle or some demarcation in exactly that precise spot. Then the second step is you're going to put your midline marker on, and I'm going to show you how to do that. Your midline marker is your crosshairs. So that is how you get the most precise injection, the most precise indication, excuse me, in terms of the reality check. So we'll talk about that in a second. Then the next thing you're going to do is you're going to put your power Doppler on. And then in each one of these spots, you're going to do the 4th part, which is the part. So that's the pressure, alignment, rotation, tilt. So the 4th part is the part. Now, these are 4 steps. You know, it took me like 1 minute to talk about them. It takes about 1 minute to do them. You know, so I always ask people who say, well, don't you have to add so much time to every filler appointment? And the answer is no. Once you get really good at safe mapping, and once you get really good at and comfortable with ultrasound, this is a very quick 1 minute check for all 4 spots. Just boop, 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 boop. Kind of do that. You don't have to make those sound effects with your mouth, but it does help to say boop, boop, boop. So you just go through.
Yeah, I was just gonna say, like, I mean, even like as new injectors, you don't start off being able to do it really quickly. So just set your expectations that, you know, learning ultrasound is like learning anything else. You know, you just have to do it a couple of times. You get better with it every time, and more comfortable and more confident.
Absolutely. Absolutely. That's definitely it, you know, and I tell people who come and train with me, they go, well, what's the first thing I need to do? And I say, the first thing you need to do is set up an ultrasound day at your clinic. Once you get your ultrasound, You're going to set up your ultrasound day. You're going to get like 5-6 patients that come to you all the time, give them like a gift card or skincare gift or whatever. And say, I'm just going to do some practice on you. I'm just going to kind of scan your face. I'm going to practice some of these like ultrasound things. I'm going to safe map a couple spots. It's going to take me a little extra time. I'm going to be like futzing with this thing. So then you kind of set the expectation, like I'm bringing on a new skill. I'm bringing on a device to my practice that's going to make things a lot safer. And you'd be amazed at the response that that you'll get from your patients when you say, I'm doing this thing for your safety, and it's just so I can be the safest injector. People will really respect you for that. So let's do some examples. But first, the midline marker, like I promised. We talked about the midline marker. To get this on, you're just going to go to your tools, and it's the top little thing, and we'll show you, Shelly will show you later, and then you'll also see in the demos. But when you put that midline marker on, you can see these little dots down the screen. That is your crosshair, and that is going to be the little marker that you're going to put over each circle, right where you're going to put your filler. So that's a really important part. One of the things that I see with people who haven't really incorporated proper training into their ultrasound is they kind of put it on and they just go, oh, yeah, that's safe. And they have no idea exactly where they just checked, because you're talking about putting a little needle in a very specific spot. And this midline marker, I want you to think about it as the tip of your needle. That's where the tip of your needle is going to go. And that is what you need to be very precise about with assessing. So you're going to put your midline marker on and be able to check each spot. So that's your step there. And then to put your power Doppler on, we'll also show you. And then when you look at the fourth part, pressure, alignment, rotation, tilt, this is really, really important. And this is the other thing that I see people do that I think goes wrong in some early ultrasounding. And that is how hard you're pressing. So I have these two pictures where this is on the zygoma. So you see in the picture on the left here, you don't see any vessels. And that's because I'm pushing hard. Now the same exact spot, all I did is just release pressure just a little bit. And you see that there's a little vessel revealed. Now, would this vessel prevent me from doing a needle bolus nearby? No, not at all. But I just use this as an example, an illustration of the view can be different with pressing hard on these tiny facial vessels. So one of the things that in hospital ultrasound medicine that you hear is like compressibility of vessels and compressibility of veins, and arteries are not compressible, veins are. And in the face, that's not necessarily true. So in the face, these are tiny little arteries that you can compress little arteries. Try it on the superficial temporal artery. You'll see that you can smush that artery. And just because it's compressible doesn't mean it's a vein. So the idea of compressibility in a vessel, it's just remember it, because you want to be very careful with how hard you're pressing the device. I like to tell people that the ultrasound is like front row seats on top of the face, where you can just kind of see just under the skin. So you're really just enough to just sit right there. So that's your pressure reminder. So in this view, you can see this is my pressure. This is my kind of pressure assessment where I'm just pressing and releasing. So this is right before I'm doing those needle boluses, right? Because this is the fourth part, the part. So with this, you can see that I'm just kind of pressing, releasing, just to make sure that there's nothing in there. Now you can also see, this is a great example of a little bit of an artifact right as I release. You can see there was a little bit of artifact. And you get really used to that. You get used to any ultrasound, you're going to have to deal with a little bit of artifact, but you can tell when it's a vessel, when it's artifact is when you're like, is that your experience, Shelly?
Yeah, absolutely. Yeah. You just learn to know what's real and what's not, just with experience.
Yeah, it's like when you learn about Santa Claus, it's like, oh, you just get to that point. It's like Santa's not real. That's not a real vessel. But Shelley and I, we love talking about artifact, and if we have time at the end, we can talk about some of our favorite artifacts. Because it's good to kind of recognize artifact and get good at understanding when something is artifact or not. So that was my pressure. And then alignment is really where you kind of think about, is my device right on top of the area of inquiry? Am I right there where I circled, or have I drifted off? One of the things that happens commonly is this kind of unconscious drift when you're scanning the face, and a lot of that happens with bad feng shui. I like to call it feng shui, when you're not directly aligned with your patient and your screen, or not in good eyesight. Because I think a lot of times what happens when somebody starts turning, they start drifting unconsciously, and then all of a sudden you're scanning an area of the face that you didn't mean to scan. That it sometimes happens. It's even to the best of us. I'll be like scanning somebody's temple, and I'm like, this looks good, and then I'll be like way over here, So it is really important to make sure that you are checking to see if your little midline marker is precisely over the area that you circled. So in terms of alignment, what I do is, here's me doing my alignment check, where I'm just barely moving it, lifting it up, going, yep, that's right where I thought I was going to be. And a lot of times when I do that, you'll see me just kind of pick it up. I'll do it right here. Just kind of pick it up, double check. Yep, I'm right on top of that mark, and it looks good. The midline marker's on, so you can see if I were about to go right down to bone, then that's where I would be. And it would be, so far so good, right? But we still have to do our R&T, our rotation and our tilt. So the rotation is really where you're just kind of doing a little rotation with your wrist. And again, you're just kind of getting yourself a little more of that cool light, you're just kind of giving yourself just a tiny bit more clearance, just to make sure there's nothing very nearby. So your alignment is just tiny little clockwise turn, counterclockwise turn, very, very small. I always joke that if I were to write a book about ultrasound, it's going to be called Tiny Tilts. And this is why, and your tilt, because your tilt is the tiniest movement of your wrist. And the reason why I want to write a book called Tiny Tilts is, first of all, because it's a cute sounding name. And second of all, because your whole view can change with the tiniest adjustment, which is also a life lesson. So sometimes all it takes is a tiny little perspective shift to be able to see something different. And why is this so critically important with injections? And that is because if you look at this view, I'm showing you, this is the view that I'm looking at to get down to bone here. So I'm kind of anticipating the trajectory of this needle along this path. So the probe would be sort of right on top of the bone right there. And I'm anticipating that if this is the trajectory that my needle is going to take, or my syringe, that it's got to be sort of tilted along that way. Because if you look, if I were to be tiny tilted up, that's a different view. This is a different view. Because remember, your pool light in the dark pool, if it's tilted just a little bit up, you're going to see those beams sort of only in that area. And then tilting back down is going to be narrow beams in that area. So it's always important to think about double checking your tilt to see, is this the same exact path that I'm planning on taking? Because this injection is very different than this injection, right? So you always have to kind of be thinking about that. So remember tiny tilts. Here's my tiny tilt example where I'm kind of showing you, okay, that's one kind of anticipated path. This is a different anticipated path than that. Either way, you'll see in both of those views, I'm trying to see bone. One of the other pearls is if you're going down to bone, you got to see bone on your ultrasound, and you got to see bone in your Doppler box. So if you see this Doppler box, I'm seeing bone and I don't see anything lighting up, right? So if this is my middle marker, here's my middle marker. And if this is where I want to go, then this looks pretty safe, but I got to check that tiny tilt just in case I go in at a slightly different angle. So now I'm going to show you, this is a radius occlusion of the facial artery. These were multiple boluses there, right along here. And this is how I would have checked that, right? So if you have anticipated kind of needle sites that you want to go into, you would just circle each one. I know a lot of people like to kind of go back this way. So you would kind of circle each little spot that you're thinking. And so this is this is how I would check that. So again, I'm moving got my midline marker on, power Doppler on, and I'm putting it right on top of the area I've circled. And now the fourth part is pressure, alignment, rotation, tilt. So I pressed, now I just pulled it off so I could check the alignment. And now the next step is that kind of rotation. So you kind of just do like tiny little rotations of the device just to kind of see, well, there's the pressure. Yep. And so each one of these spots, you're going to do the same exact steps. So in the videos, that's what you see. And then again, there's your rotation. And then your tilt is really where you're kind of saying, what angle am I going to go in at? A little bit like this, a little bit like this. And you kind of anticipate that trajectory. So the chin is a popular area to safe map. I actually, every time I do a lot of chin, I love doing chins, and I always do just a quick safe map. This was an occlusion. Actually, this was a pre-jowl sulcus occlusion that got an ascending, the ascending branch of the submental occluded. So we could have checked that pre-jowl, but because the chin is so popular, I'm just going to show you a quick check on the chin. And so for the chin, we really want to get that chin hill view. I call it chin hill, where in women, a lot of times we just want that midline bolus. And so you really do the same thing. You start with, where do I want to put the filler? You put your circle right on the midline of the chin, or whatever you want to do. And then you got to see that bone there. We've got our midline marker on and our Doppler on. And then we just go through our pressure, alignment, rotation, and tilt. So that's what I'm doing here. This one's a little bit slower, but I can drag it along. And you just kind of see each one of these steps in action with each spot. And then there's my tilt check, where I'm kind of demonstrating the angle that I'd want to go. Now the chin is one of those areas where a lot of times we want that sort of downward projection. A lot of times we want the anterior projection. So it's a great time to kind of think about, okay, what am I doing? And exactly which angle am I going to hit it? And I always advise to be in the transverse scanning plane. We didn't have time to go over all that today, but the transverse scanning plane where your nubbin's going to the left. And that's really how you're going to capture chin hill. So in short, safe mapping, it's a lot easier than the challenge of vascular mapping. And I think a lot of times when people hear about ultrasound, they hear about this vascular mapping, they go, that sounds kind of scary. I don't know about that. I don't know if I'm gonna be able to do that. And you're really not doing that. You're really just checking the spot that you want to put your filler. That's the first thing you're doing. We're injectors, right? So we want to start with our artistic eye of, where do I want to put the filler? Is it a safe spot? There are a lot of times, just earlier today, where I did a nasolabial fold filler, and I knew exactly where I wanted to put my filler in the nasolabial fold. I just checked, is my angular artery right underneath that fold? It wasn't. Did I find the angular artery? No, I didn't need to. So a lot of times I think people get really kind of derailed by the pressure of finding the vessel in every area that they're injecting. So it's a lot easier to think about safe mapping. It's a lot easier to find a precise needle spot rather than a whole vessel. Safe mapping is a great intro for new ultrasounders. And last but not least, it's fun. I think it's really fun. So it's quick and easy. The thing that happens to a lot of people who start out as the kind of nervous injector that we saw at the beginning of the presentation, the people from NIS, nervous injector syndrome. A lot of times I see people get into ultrasound and then they become what I call face nerds, where they just become so fascinated by the whole face, and then this kind of thing happens. So I'll show you this one. This is my friend Shad from Comedy. Comedy Days, I pulled my old comedian friends in. I said, I need you to be in this injector video.
My God, you have the most fascinating variant of the superior labial artery.
What does that mean?
Your anatomy is so special.
So, can you do my lip?
Can you stop talking?
So, so that's one of the things I think happens when we get into ultrasound. You learn so much about the face and the anatomy, and you're just like, oh my God, this is so cool. But I do think it's important to remember, you don't need to find every vessel to use ultrasound. You just need to find your safe spot. So, so that's it. That's it for my presentation. I have tons more to say on ultrasound. I have a lot more techniques that I love sharing with people. Everyone can hop on my Patreon. There's a link on my Instagram for that, where I try to do a lot of pearls. Don't follow me on Instagram if you are bothered by injector comedy, because sometimes I do that. And then, yeah, my website is where you'll find all the registration for my courses. So that is it. I think that's where we go to questions, right, Shelley?
Well, I'll jump in and do a live demo first. Yeah, but yeah, I encourage people to keep asking questions in the Q&A box, and I'll head over to our model and just do a little live demo of your technique here. So the first thing I'm going to do is, just like you said, Dani, I'm going to just put a little marker on, say the gonial angle here, just to demonstrate how we can use our center guide here as well. So I'm using the Clarius, the L20 20 megahertz scanner here, and I've chosen the chin jaw presets. Now we have a whole bunch of forehead temple, a whole bunch of facial aesthetics presets that will get your imaging parameters a little bit closer to where you want to be, which, the goal being less adjustments so that you can focus on your patient. And so I'm just going to put the scanner. Oh, and the other thing I'll do is, I don't know if you could see this, but I'm going to put my scanner, the indicator, right in the center of the scanner here, right over that green dot. And just so that we know we're accurate here. And then the other thing I can do is I'm going to just turn on new feature called voice controls, so that if I'm not near my iPad or I don't want to reach for it, I can just operate the settings with the voice controls. So I'm going to just tell the system to activate the center guide. And so now we can see this nice dotted line down the center, which corresponds exactly to that center marker on the scanner. So if that's where I'm going to inject, then that's an accurate representation of where my injection is going to happen.
Yeah, and I would even say to increase your depth just a little bit, just so you are seeing that bone, in a really good. So if you're going down to bone, you got to see bone.
So here's the bone here, the bright white.
Mm-hmm.
All right. So let's turn on the color mode. And I just use my voice controls there. And I'll just move the color box up. And we can start our part. So we can do our pressure. So if I push, you can see that the bone comes closer to the scanner. And then if I ease off, image has changed quite a bit, but now I'm confident that I'm not going to be squashing a little vessel there.
Yeah, and also, Shelley, you want to make sure that, yep, your color box is, even when you're on that light pressure, that your color box is still demonstrating the bone.
Okay. Now, if I'm just going to show, just in the interest of what the color would look like, if I move a little bit more toward our model's chin, there I'm starting to get some nice color Doppler signal here.
Yep. And that's where one of those kind of revelations that, Santa's not real, because you can see that's clearly a vessel, and when you're on artifact, it's when you're like, what's all that?
Yeah.
When
And
you're
if
on a vessel, it's pretty clear.
Yeah, and if I jiggle up and down, and you can see that's artifact for sure. There's no doubt in my mind that's a larger vessel, and then there's a tiny little vessel up here. And part of that is just selecting the right preset as well. That will get your color Doppler settings more to where you need them to be for facial vessels, so that you can be confident that you're seeing the right thing. So if I just go back to my, sorry.
Oh, sorry. I was just going to see if you wouldn't mind just showing power Doppler too. Because I really like power Doppler, because you don't really have to deal with any blue or red.
Exactly.
Power Doppler also will pick up even the smallest vessels. So the color, obviously color Doppler, you have red and blue. And I think a lot of people, when they're starting out, they get kind of confused that red means artery and blue means vein, which is not true. Red means flow towards the probe and blue means away from the probe. So when you put it on power Doppler, this PDI like Shelley's got, you can see that it's just flow. So I really like power Doppler. I teach power Doppler because I think it just makes it clear. Like, do you need to know if that's artery or vein? Not really. You don't want to hit it.
Exactly. Yeah. And I think, the one little disadvantage of power Doppler is that because it's so much more sensitive to low flow and smaller vessels, if you are moving around, you may get a little bit more artifact. But again, that just comes with practice. So yeah.
One of the things you can do to minimize artifact with power Doppler is you can really shrink your Doppler box to the focus where you want it to be, because the more you ask it to examine for Doppler, the sort of less reliable it gets. So just look how much cleaner it looks just by shrinking your box. And if you are choosing between a wider box or a more narrow box, always go with a more narrow box, because that will allow for like the most precise determination. Wider sort of scatters it a little.
Right. All right. So if I go back to my little marker area here, I can do so we did the pressure. So I'm doing the alignment here. So just kind of back and forth a little bit, make sure we're on our marker.
Right. You're just picking it up just the tiniest little bit, just checking. Great. Beautiful.
Okay. And then the R is going to be
the
rotation, like this. So I'm just slowly rotating to make sure that no vessels come into view. And then a tilt, just to make sure that we're coming in at the right angle, or ensuring that the angle that we want to inject corresponds to the angle of our image.
Exactly. That's that kind of tilt check of like our trajectory check.
Yeah.
Great.
And just kind of for interest's sake too, if I again go a little bit medial here, we can see some existing filler here, with again a little artifact here right next to the vessel.
Right, exactly. So that's another type of artifact that you're seeing that looks like a PMMA, with the sort of like that ill-defined comet tail artifact there. And comet tail, you want to point out, those sort of streaking shadows like that
in here,
posterior. Exactly. So that's another cool artifact, and a lot of times, we won't get into identification of different fillers today, because that's a whole nother sure. But
Okay.
but using these artifacts, kind of understanding the artifacts, I think is really, you can use them to your advantage,
Right.
give you information.
Okay, great. Okay, Dani, well, in the essence of time here, I'm just going to step off here and we'll just hand things back to Janess just to give a little product brief for us.
Thank you, Dani, for sharing your patented technique to avoid complications with safe mapping. And thanks, Shelley, for the fabulous live scanning showcasing our new voice controls and some of our dedicated aesthetic presets. Just before we open up the floor to questions with our expert guest speaker, Dani Shear, here's a quick poll for you. We'd love to help everyone continue on their journey in bringing ultrasound guidance into their practice. So please do complete this poll if you'd like any additional information, and you can click on as many options as apply. We have a global audience today, and pricing and availability does vary by region, so feel free to request a quote and pricing. You may opt to speak to one of our experts about the advantages of wireless ultrasound. If you'd like to discuss scanner features, please select that option. You can also book a virtual one-on-one demo with our experts to see the new Claris HD3 in action. And we can send you more video tutorials with experts like Dani Shear and Dr. Weiner. So go ahead and select as many options as you wish. While you complete the poll, I'd like to take a minute to introduce you to the Claris L20 HD3, the world's only ultra-high frequency ultrasound in a 20 megahertz handheld scanner. You no longer have to purchase a bulky system that's costly and complex to learn in order to improve patient safety and outcomes. Claris Ultrasound has changed the game in facial aesthetics by miniaturizing high-definition ultrasound, making it easy to use and affordable, and delivering image quality that rivals traditional systems at a fraction of the cost, representing over 85% savings. And with the Claris Power Fan, you can keep your scanner cool with limitless power supply, so you can scan as long as needed if you ever need to treat a complication. With best-in-class high-definition imaging of the skin, muscles, vessels, facial layers, you'll gain confidence in your needle placement, easily characterize and evaluate fillers, and more accurately treat complications, improving patient safety with consistent treatment outcomes. And before I tell you more about Claris, I'd like to share 2 published studies to help you feel confident about selecting Claris for your practice, one from Europe and one from the United States. First, the positioning statement on dermatologic ultrasound by the European Federation of Society for Ultrasound in Medicine and Biology. It states a minimum transducer frequency of 15 megahertz should be used for dermatologic ultrasound. This means that Claris is actually the world's only handheld ultrasound to meet and exceed this guideline and recommendation. Second, an independent study, unbiased, was recently published by the Keck School of Medicine at the University of Southern California. To help clinicians choose the best point-of-care ultrasound scanner for aesthetic and ophthalmology medicine, they rank the image quality of 5 POCUS devices. The Claris L20 HD3 received the highest rankings, followed by our Claris L15 HD3 for overall rating, ahead of 3 other alternatives. So how does Claris deliver best-in-class image quality? Each scanner features not 1 or 2, but 8 beamformers, 192 elements, and artificial intelligence that together deliver the crystal clear image only found in traditional systems. We've eliminated complex knobs and buttons, making ultrasound imaging fast and easy to use. Claris is also wireless, freeing up space with 0 footprint. It's fully immersible and so much faster to clean and disinfect as well. Only Claris delivers wireless scanners with an ecosystem that includes a free app for your iOS and Android devices with free updates. Available with our new membership, Claris Cloud allows you to easily capture and manage unlimited exams from anywhere. Your membership includes in-app Claris videos with experts like Dani Shear and Dr. Stephen Weiner, as well as onboarding with a clinician to build up your Claris skills. Claris Live offers one-touch telemedicine if you'd like to share live scanning with a colleague. Our new voice controls act as your AI-powered assistant. With one hand on your needle, the other holding your L20 scanner, you can use your voice to add color Doppler, needle mode, increase gain, decrease depth, capture video, and much more. Also included with your membership, the advanced aesthetic package includes AI-powered features to automate workflows like vessel depth AI, as well as the new aesthetic presets for the lip, temple, forehead, piriform, cheek, and chin to automatically optimize imaging. We'll now take 3 seconds to close the poll. 2, 1. Thank you for participating. We'll get back to you in the coming week. I'd like to now welcome back Dani and Shelley for our live Q&A session. And since it's a common question, I want to let everyone know that a recording of today's session, as well as a PDF copy of the presentation, will be emailed to you in the coming days. Please use the questions icon now in the menu bar to ask your questions. And Shelley, if I could ask you to moderate, please.
Great. Okay, one of the most important questions was, Santa's not real?
I really hate to break that to everybody.
Yeah.
Sorry, Mike.
Okay.
Yes.
Yeah. Okay, this is a great question. When you're looking at a spot under ultrasound and you cannot detect a blood vessel, how do you know that there is actually no vessel? For example, I have yet been able to detect a temporal artery with the Clarius device, as if all patients do not have this artery.
So, I mean, that is a great question. I mean, I think a lot of the times you have to just practice. You practice scanning, and that's where I think it's important to, you want to practice looking at vessels. I don't want to discourage people from looking for vessels in their spare time. Practice on the faces. In fact, when you come to my course, I give you a scavenger hunt, find all these vessels in the face. So it is important to try to practice that. Try to find the superficial temporal artery on as many people as you can, because a lot of times it's just a matter of trying to scan and find the right plane, adjust your gain. I have really enjoyed working with Clarius to try to find the right settings for each area. So if you put the scanner on in the temple, and then make sure you're trying power Doppler, okay? Because I think a lot of people are using color Doppler, and the power Doppler, you're going to pick up more those little vessels. So I do encourage you to try power Doppler, try to scan as many faces as you can, try to scan a child's face if you can. They have good vessels too. But do you need to do that in order to inject, in a certain area? No, that's the difference between safe mapping and vascular mapping. So I think it's just a matter of trying to slide your gain up. So when you get into a Doppler, try to slide your gain up. Even if you're doing in color Doppler, try to increase your gain, because a lot of times it's just maybe flashing small, and you just increase your gain and try to practice that. Because you should be able to find the temporal artery with the Clarius.
And there was another question about a vascular setting for safe mapping or aesthetic setting. And part of the membership includes the fine tuning for the different parts of the face. And a lot of those settings have to do with the color Doppler settings to make them much more sensitive to those small, tiny vessels.
Mm-hmm. Mm-hmm.
Yeah. Let's see here. With the pressures, are you just playing around with the amount of firmness you are applying?
Yeah.
Like how much pressure?
Yeah, you really want to kind of go from kind of smushing and then just releasing. So you're really just sitting on top of the skin. I usually just do kind of a little pressure and then just let it, so it's just sitting on top of the skin. You never want air under your probe. So if you've come off the skin so far that you've suddenly got air, you're floating above the face. So you want to kind of go press down and then just enough so that you kind of just check to make sure. A lot of new injectors or new ultrasound injectors, they kind of get really intense and they're really smushing. That's the other thing to the question about not finding the superficial temporal artery. That's one of the most squishable vessels in the face.
Yeah.
So I would say check that you're not smushing it. So a really light pressure, try that, adjusting your gain, and power Doppler, you should be able to find it. But so what other questions do we have?
We're at the top of the hour, but I think we'll probably just go over a few minutes here because we have some great questions here. One of them is asking, are you able to identify different types of fillers with the Clarius ultrasound?
Yeah, absolutely. I think one of the questions was the lovely Jerry Obi, who was asking about Juvenin versus Restylane. Really, it's a lot harder to differentiate between different types of HA, but you can absolutely differentiate between HA, PMMA, radius, you can definitely differentiate between some of those. Silicone, that stuff's really very easily identified on the Clarius. Yes.
Right. Yeah. Yeah. All right. Well, in the essence of time here, Dani, I think we'll call it here. Thank you so much for a great webinar. Lots of great information and tips and tricks for people to go back to their practices and practice.
Yes.
Thank you very much.
Thank you.
Great.
So much.
I'd like to also thank everyone for joining us today and for all your wonderful questions and for staying for the live Q&A. There were a lot of questions, and if we didn't get to your question, we will follow up with you by email in the coming week. A friendly reminder that you'll receive a copy of the slides and webinar recording in the coming days, so keep an eye on your inbox. And please do complete our closing survey to provide your feedback so that we can continue to bring you more educational webinars like today. To conclude, I'd like to thank Dani and Shelley for all of their insights, and a very big thank you for joining us today. Have a wonderful day and keep scanning. Thank you.
Thanks, everyone.
Thank you so much. Thank you all.
Bye.